my name's Tom, for those of you who I've not met or those who I've not spoken to. As Rashid said, I work on behalf of Arthrex and the Biologics team. We're based out of Dubai, working closely with Havana. First of all, welcome to our Autocart segment of this meeting. Thank you for being here. Thank you for taking the time to spend with us. I'm sure you'll enjoy it. I'm sure you'll gain a lot of knowledge from the guys who are going to be speaking today. So without stealing any information or any of Dr. Hull's talking points, which I'm sure I won't anyway, I just want to say a few things about Autocart before we begin, just to start us off. As Rashid said, it's one of the newest solutions to cartilage regeneration. And over the last 2.5 to almost 3 years now, we've had some incredible feedback. We've had some great results, and we've done well over 4,000 cases now within Europe. Of course, a number of cases also coming out of India as well. So what is it? What is Autocart? And I'll just give you a quick brief before I pass on to Dr. Hull. So it's a fully autologous procedure to treat chondral and osteochondral defects. Just to set the scene, just to give you a little bit more of an idea before Dr. Hull begins, we always talk about the importance of this healing triad when it comes to regenerating tissue. So these 3 cornerstones that we talk about, where your growth factors are involved, your regenerative cells, and a scaffold, all of which we say are combined, provide an optimal environment for tissue regeneration and tissue healing. And there's a number of products that we use during the Autocart procedure that make this possible for us. So within these 3 cornerstones, the first, which is our regenerative cells, we use a resection tool, so a shaver blade, ideally a 3mm saber shaver, to resect and harvest the cartilage chips from around the defect, ideally. We've then got a product called GraftNet. Now this secures and collects the chips that we harvest, and then we can use those chips to re-implant into the defect in a single stage. Our growth factors, that comes from our ACP system. It's our version of a PRP that provides our growth factors to our cartilage chips and the surrounding environment. So that's our growth factor portion of the procedure. And then we've got a product called the thrombinator, which covers the matrix and partly growth factor segment as well. So this is our fully autologous fibrin glue. This acts as our end scaffold, our end sealant, if you like, and like I say, with the addition of growth factors as well. So we're lucky enough to have online with us today Dr. Hulls, one of our very early adopters of the Autocart procedure, Dr. Kundra, who is there with you guys as well, and Dr. Gajar, and they'll all be sharing their knowledge with us on cartilage regeneration in general, as well, of course, Autocart, our focus today. So having graduated in '92 from the Medical University of Hamburg, Dr. Hulls currently operates in Hamburg at Ortho Centrum, as well as Park Clinic in Mannhagen. He's worked with a number of first-class soccer teams and hockey teams over the years, has special interests in reconstructive cartilage and tissue repair, meniscus repair and transplantation, ACL and PCL surgery, as well as arthroplasty of the hip and knee. So that's enough from me.